Hello everyone, myself Sakshi Pal, a student of second year of Bachelor of Physiotherapy. Today I'll be presenting a topic of electrotherapy. The name of the topic is microcurrent therapy, which is also known as MENS, which is microcurrent electrical neuromuscular stimulation. Basically, microcurrent therapy is a low intensity current therapy which usually ranges from 1 to 1000 microampere. Basically, it mimics the natural current produced by our body, due to which oftentimes the patient doesn't feel anything during the treatment. It mainly focuses on tissue repair. Now, introduction to this microcurrent therapy. So, definition is, as we discussed, it is a low frequency electrotherapy modality delivering extremely small pulsating currents, and it is usually below subsensory range. Now, it mimics the microcurrent produced by our body or our cells. Its clinical focus is outstanding efficiency in pain management and rapid tissue cellular healing. Principle. Principle of this microcurrent therapy is cellular bioelectricity. As we discussed, the healthy cells our body naturally produces small electrical current. When tissue injury occurs, this electrical flow is heavily disrupted, shifting the cellular membrane potential and halting cellular metabolism, which also, if the current is not produced properly by our cells, it halts or it creates hindrance in cell metabolism. Basically, the principles are restoration and biostimulation. In restoration, introduces compatible current aligning the cell polarity, and in biostimulation, it acts as the subsensory level to catalyze homeostatic restoration. Now, the physiological effects of microcurrent therapy are cellular energy upregulation, vascular and inflammatory relief, and anabolical repair cascade. Mechanism of action. The ATP fuel mechanism. Microcurrent therapy targets the powerhouse of the cell, the mitochondria, because it operates within physiological microamperes, stimulates rather than overload cellular function. Basically, the mechanism of action consists of three things. Proton gradient, which means it increases the proton movement across the cell membrane of mitochondria. Amino acid, which enhances active cellular transport. And third one is restoration, which means it resets homeostatic membrane values, lowering pain signals. Clinical indications, when to use this therapy. Basically, you can use it when it is exceptionally suited for treating acute tissue damage, soft tissue injuries, and systematic inflammatory disorders such as musculoskeletal strain or sprain. It helps in healing the tissue. Chronic pathology pain, it helps to manage pain in arthritis and several conditions. Dermal recovery, exceptional for non-healing chronic wounds, ulcer, and post-surgical scars. Contraindication, when to avoid this therapy. Though microcurrent is exceptionally safe, it is often not even felt by the patient during the treatment. The therapist should still be aware of the contraindication. The first contraindication is pacemaker and cardiac defibrillator, as it can affect to the microcurrent or pulse of the pacemakers. Next one is malignancy and active tumor. Pregnancy, it is avoided in pregnant women. And third one is near carotid sinus and the people suffering from epilepsy attacks. Treatment procedures. First part is assessment. Properly assess if the patient really needs this therapy or not. Next is placement, the position of electrodes. Third one is parameter, which is between 100 to 500 microampere and frequencies between 0.1 to 100 Hz. Next one is therapy. Deliver microcurrent continuously for 15 to 30 minutes. This is the time range. Next one is to frequently monitor the patient and the device, if it is delivering correctly or not. Advantages. High patient compliance. During the treatment, the patient doesn't feel any pain or anything, so it is highly compatible for the patient. Next one is integrative and safe. It has no pharmacological side effects. Integrate easily with therapeutic active exercises. You can give it during rehabilitation also. So basically, what as a physiotherapist we can do to enhance the tissue healing and reducing pain using this therapy? Directing clinical care, the therapists act as a critical bridge, ensuring that the microcurrent parameters match the clinical stage of tissue injury. So, diagnosis. First one is diagnosis. Assess skin impedance, stage of inflammation, and patient sensation. When we are giving the treatment, we should also take in consideration about the skin resistance of the patient. If the patient has applied any lotion, or the skin of the patient is very hairy or very sweaty, or the patient is suffering from any several conditions, we should take it in consideration. Programming. The programming of the machine should be set efficiently and correctly as the need of the patient. Next is progression. Successfully transition from passive microcurrent therapy to functional or active physical training. To include this microcurrent therapy while giving rehabilitation and active exercises. This is the summary in which we discuss definition, principle, effects, indications, when to avoid, how to give, what are the benefits, what are the rehabilitation role, and okay. So, microcurrent therapy is highly safe, painless, and biologically effective electrotherapy modality that promotes rapid tissue healing, cellular energy by mimicking body's natural endogenous current. These are the academic references. These are the image references. Thank you for watching.